Hello, everybody, and welcome to our Migration Policy Center webinar on gender-based violence and migration in times of COVID-19. My name is Laila Hajabdu. I'm a fellow at the Migration Policy Center here in Florence, and I'm really delighted to have you all with us today and to have also a wonderful group of speakers. This current health crisis has exacerbated many social, political, and economic issues that have actually predated this crisis. And gender-based violence is one of these issues. And I really want to stress at the beginning of this webinar, it's not that the pandemic has created violence, but actually, I think what we will also discuss, it has trapped much more women that already were affected by violence into a vulnerable situation. And the crisis, not only in terms of violence, but it's in many, many ways gendered. But too often what we hear and see that experts that talk about the issues are exclusively men. So the more I'm really delighted that we have a fantastic group of female speakers today with us who share their insights on the issue. And it's not only a fantastic group of speakers, it's also speakers really from all over the world who can provide a holistic perspective on the issue. But before we start and I give the floor to our speakers, I still want to give one last time the word to a man by citing one, namely one as a perpetrator of violence, because I think we also seldomly hear this perspective. And this is one of a report from the GZ, the German Development Agency, and I just want to briefly quote it before we go into the discussion and the presentations by our speakers. So I quote, "When it came to women, I felt that as a man, I was always right. It is about masculinity. I have to show the woman that we are not equals. I am stronger. These are the attitudes we shared with my peers," we would say. "Hey, look at this guy. He's listening to what his girlfriend is telling him. He's a weakling. No man wants to be seen as a wimp. In my relationships, even if I wronged the girlfriend and she tried to tell me so, I would say, no way. But deep down in my heart, I knew that I had done something wrong, but I couldn't admit it." So also this little quote also shows you already the relevance of gender-based violence, but also primarily also in a domestic family context. But we will hear much more, and especially now about the context of COVID and in the context of migration from our speakers. And I would like to ask Jenny Phillimore from the University of Birmingham, so Professor Phillimore, to take the floor and to give us the first insights from her perspective and rich expertise on the issue. You have to unmute yourself.
Okay. Right. Good afternoon, everybody. I'm going to be talking briefly about a recent research project completed, and the presentation is on accumulative violence, forced migration, sexual and gender-based violence survivors, and COVID-19. Just trying to, why won't my, oh, there we are. Now, it's well established by now that in the pandemic, the effects of the pandemic are shaped by socio-economic inequalities. And I'm the project lead of the SARIDA project, which looks at sexual and gender-based violence, forced migration, vulnerabilities and resilience across 5 different countries: Turkey, Sweden, Tunisia, the UK and Australia. So we were approached by a number of NGOs, civil society organisations, to ask us if we had any evidence about the effect of the pandemic on forced migrant survivors of SGBV. This prompted a very, very quick research project where we asked the question, what is the effect of the pandemic on forced migrant survivors? We've written a report on this, and you can access this online. You'll see a link in a minute. Policy briefs, and the findings were reported by 30 different agencies across the world. So it's been really good to have that level of impact, but it's been very practitioner orientated so far. This is our first attempt at developing an analytical framework, which will eventually form the foundation of an academic article, which will complement the report and the policy briefs that we have produced. So what we're doing is we're looking at structurally produced violences, and there are three aspects to this. There's slow violence, looking at Mabelin's work, violent uncertainty, Grace et al. In the New England Journal of Medicine, and violent abandonment, which is used extensively by Davies et al. And others. More about that later. Just very briefly about the methods. We were fortunate because we have completed the majority of the interviews for the Sarita project, the 5-country project, that we already had an infrastructure set up. So we accessed a very small amount of funds. And then because we have a large team, we were able to return, obviously not face-to-face, to interviewees in the 5 countries. And we did 97 interviews between the 14th and the 28th of April. It was a hectic time. These were short telephone interviews, lots of WhatsApp messaging backwards and forwards and emails. And we asked survivors just one simple question: how has the COVID-19 emergency affected your life? Obviously, we accessed consent, and the interviews were undertaken in a number of languages because we have a multilingual team. Data analysis used a thematic approach using the short transcript and type responses and basically whatever materials we had. 97 interviews. You can see a few more survivors and service providers. The service providers were those we'd spoken to in interviews before, who worked with survivors and were able to give us an overview of what was going on. The majority of data was collected in Tunisia, Turkey, and the UK. Okay, let's start with slow violence. This is leaning on Lucy Mabelin's work. And basically, slow violence is structural violence that's occasioned over time in a way that's invisible but affects individuals' everyday life. And what we found that in terms of that the pandemic intensified or exaggerated the slow violence already experienced by SGBV survivors, who I should say were women in this study, although in the wider study we do include men. What we found is that people had lost their informal support and informal employment, and there was no social welfare for certain groups. So, you know, for those irregular immigrants or for those with temporary protection in Turkey, no access to resource to support them whatsoever. So clearly this leads to a situation where people are unable to afford food and hygiene, or they had to make the choice between food or hygiene products. And basically everyday life, which is a struggle for those experiencing slow violence, became more of a struggle. And the survival strategies that Mabelin talks about that are actually key to surviving slow violence are undermined by the pandemic restrictions. So once again, people have to rethink their survival strategies and they don't have many options. We also find that people, of course, were immobilized. The pandemic prevented movement, and frequently SGBV survivors use movement to survive or escape violence, but also to get through on the everyday basis to access key resources. So they have to travel a long way for cheaper foodstuffs, and this was not possible. Enforced isolation was a reality, of course, for the majority of people, not those in Sweden, because of the pandemic restrictions. But a key issue here was lack of data and Wi-Fi. So it's a really important aspect to resilience to be able to access social networks, be that civil society organisations or quite often networks of people who've been through the same situation. Without access to virtual mechanisms to connect, many survivors were extremely isolated, so they couldn't share the burden of isolation and their fears around the pandemic. People had to make extremely difficult choices and faced increased risks if they tried to develop strategies to address those choices. And what we heard of was invisible hunger and dehumanization. Excuse me. Moving on to the violence of uncertainty, which leans on Grace et al.'s work. And this is basically living in a state of uncertainty, which undermines your well-being and, you know, an interminable waiting to access maybe status. And already we learned from the Sarita project that Many people's lives are on hold. They're awaiting access to a resettlement place if they're in Turkey or Tunisia, ever hopeful, no certain outcome. And in other countries, they are undergoing, they are part of an asylum process. And what happened is resettlement programs were suspended. They've been on hold in the UK for 6 months, but pretty much across the world. And asylum claims were largely placed on hold as well. And this quotation by an East African woman in Tunisia really sums up the feeling that emerged from the interviews. I feel that as if I were inside a jail because of corona, as if I were tied with a chain. I can no more recognize myself. I feel exhausted. I hate my life. We can no more think or work for the future. The third category is the violence of abandonment, which I mentioned has been used by Davies et al. Amongst others. And this is the idea that governments and others abandon people who are vulnerable, knowing full well that not providing for their needs, not providing support, will occasion them harm. So they don't occasion the harm directly, but it's kind of indirect harm. What we found is that survivors actually really struggle to escape from interpersonal violence because they're trapped in houses or other places with perpetrators. And there was an increased exposure to trafficking and no services for SGBV survivors. So a lack of safe houses, but nowhere, no one's at the end of a phone. Everything has gone digital. So it's really hard to quickly make a phone call and say, help me, I don't know what to do. There was an absence of any kind of support mechanism, whether that be material support, food support, psychological support for the most vulnerable. So they were just left. And there was no attention to everyday needs. So despite the increased risk of infection, those living in overcrowded accommodation, which is often the case in detention centres or in asylum housing where you're sharing with strangers and there are a lot of common spaces, you're just kind of left to get on with it. There's no increase in allowances, and in some cases allowances or charitable donations have ceased. And there's no mechanisms to help people avoid the risk of infection. So there was no ability to social distance in some places. And also access to trauma services ceased. So those who were undergoing some kind of counselling, who were extremely vulnerable, had to cease that. And children were unable to access education. So where in many countries education has moved online, because they don't have access to Wi-Fi data, that wasn't possible. So there were many implications for SGBV survivors, and I can sure you appreciate that in just 10 minutes I cannot go into this in detail. But what you find is that there was an actual increased risk of sexual and gender-based violence associated with the pandemic restrictions. So enforced dependency, if you don't have an income, then you have to depend on others, and that can be exploitative without the prospect of escape if you were subject to further violence. We heard of increased risk of trafficking, traffickers reaching out to women again to try to draw them back in because they knew they were desperate, forced prostitution, increased child marriage just to try and to support children to survive, and increased risk of honour-based violence. But what came up, the biggest message here was the intensified psychological trauma, which comes with the uncertainty, which comes with the everyday struggles, and which comes with the social isolation and the sheer inability to connect in any way, shape or form. Again, I've got a quote here from a sub-Saharan African asylum seeker in the UK, and she sums up some of the sentiment expressed by other respondents very well. Because of past violence, sometimes it makes me get those suicidal thoughts. I don't know how to explain it. You feel like you're stuck, start getting flashbacks, frustrated, start thinking too much. Many of the women described themselves as overthinking, as if it was somehow their fault, but they were without distraction, unable to escape, unable to connect, and worried about where their next meal was coming from. So the very experience of being trapped indoors, that some of them reminded them of earlier traumas where they had been imprisoned. So the message here, unfortunately, was that people were experiencing the end of hope. They may have gradually been moving forward, but now they felt they were going backwards and not forwards, and that the progress that they may have made over the period, the previous months and years, was unfortunately reversed. So in conclusion, very weak, very tentative conclusions here. This is the first time we've applied this framework to this data, and more work will be going on over the next few weeks. But essentially, well, there's a strong message that structural violence is a real concern in relation to survivors, and it's exacerbated in the face of the pandemic. So what we see is slow violence, we see the destabilization of everyday lives, and this is actually generating physical violence in the form of hunger, which is a physical violence, which is in the form of enhanced trauma and further abuse. So a direct relationship between the structural and the physical. We found that the pandemic restrictions, hiding women away indoors, further invisibilize the invisible. And this is a group of people, hardly, very varied, who already receive insufficient attention, insufficient resource, and insufficient care. What we're doing now is exploring, expanding our analysis to bring in a necro-political analysis to ask questions around, why is this hurt tolerated? Is it seen as being for the greater good? What is the reason for the abandonment of these women? Thank you.
Thanks very much, Jenny. Thank you so much, Professor Phillimore. So I would now propose that we hear from Jane Diguna from UN Women. Dr. Cunha, if you could take the floor and present also your perspectives. But before, I just want to remind everyone also again that you can pose questions in the YouTube feed, which then I will summarize and take to our speakers. If you could just indicate to whom specifically your question is, this would be very kind. Yeah, but the floor to you, Dr. Cunha.
Thank you so much, Laila and MPC, for inviting us to make this brief presentation that really speaks to the specific context mediating violence against overseas women migrant domestic workers in normal times and in the pandemic, and recommendations for action drawing on existing good practice. So to begin with, domestic work is a very feminized sector, and women constitute 73% of the 11.5 million overseas domestic workers. Well, women's unpaid care work in homes, constructed as a labor of love, naturally emanating from the very depths of women's beings, not requiring any particular skill, not paid for, not accounted for in GDPs, is not considered work, even though it contributes to life, to the workforce, and to keeping the wheels of society moving. And much of this construction mediates the low value of domestic work, which is often excluded from labor law coverage, from social protection coverage in many countries, because it's not considered work. Many temporary women migrant
Jane, your mic has gone unmuted. Can you put it again? Mm-hmm.
Yes. Many migrant workers, particularly undocumented workers, are actually excluded from or not adequately covered by violence legislation or access to violence services. And in particular regions, a worker's entry, stay, work, and sometimes even exit is tied to the particular employer. And very often these employers confiscate their travel documents. And all of this heightens dependence, abuse, forced labor, and turns workers undocumented, particularly if she's fleeing an abusive situation or she contracts a job with another employer without the previous written consent of her current employer. And this places her at risk of arrest, detention, and deportation without any access to justice. Well, the private, the isolated, the dispersed nature of domestic work, the overlaps in living and working arrangements, particularly for live-in domestic workers who are locked in with abusers, the lack of access to complaints, grievance, monitoring mechanisms, the racial and the nationality othering of domestic workers and the construction of them as commodities needing to do drudge labor, particularly when host country nationals cannot or will not perform this, all contributes to economic, to social, to physical, to sexual, to emotional violence against them. And not just from employers, but also from state officials and elements in the recruitment chain across countries. And this really complicates the issue in terms of access to justice, particularly for undocumented workers. And of course, not to mention family violence, community violence against them, particularly when they return socially, sexually violated, or in this case, COVID affected. So COVID, as our previous speaker pointed out, has really bared the structural flaws in our social fabric and ethic, which often or largely lives off discrimination of various kinds, including gender-based discrimination in the care sector as well. And the care sector has been at the front lines of response, and it includes women's unpaid care work and domestic work. So what is this impact on domestic workers? COVID-related panic, increased xenophobia and abuse against particularly live-out part-time domestic workers because they're constructed as vectors of the virus, and many of them lost jobs overnight. In irregular conditions, without access to income, without access to resources, they were really stranded with lockdowns and border closures, susceptible to debt, their health at risk, and at risk of being arrested, detained, and deported. Many documented workers, were also terminated overnight without any compensation because of employer panic or because they were unable to pay wages. And many of them were forcibly sent home to countries of origin before airports shut down, before their contracts ran the full course. Remittances were not transferred very easily because of mobility restrictions and displaced families in dire straits. Workload increases, work hour increases, abuse, stress levels because of lock-in with abusers, the entire family teleworking, family panic, stress and tension, obsession by families with cleanliness were important and significant problems that workers face. Also, the increase in the use of internet services by families resulted in restrictions being placed on the use by domestic workers, which cut off communication with their families, with their acquaintances, accessing hotlines to make complaints, web portals or websites to get information, or accessing online counseling services. And where they did get external assistance, they often hesitated to take action because of the uncertainty of the whole lockdown context and fear about losing jobs. Both documented and undocumented workers, domestic workers, have found it very difficult to access health services, even in those countries that have introduced free testing for everyone, including migrant workers. Often without protective equipment, domestic workers are at risk of contracting the virus when they care for COVID-affected family members, or they are sent out on errands without protective gear. And undocumented workers are particularly at risk, particularly when they live in crowded rental apartments or detention centers or shelters, which are really stressed and don't have the basic amenities, food, water, sanitation, toiletries, COVID-related hygiene products, which are really necessary for women's health, well-being, and privacy levels to be maintained. Well, I do wish to say that every crisis, and this one as well, is an opportunity to build back better. So what is being done and what needs to be done? UN Women, together with other international organizations, UN organizations and civil society groups, has been undertaking research, has been consulting with women migrant workers groups and their support groups to identify the key priorities that they have that can be built into our advocacy with governments for policy reform. And we're supporting migrant worker organizations to do the same in 3 areas: work-related, so the need for timely and full payment of wages, rest days, a period of notice given to workers by the employer should the contract be terminated so that the worker has time to contract another job, provision of personal protective equipment, and facilitation in the transfer of remittances. And the government of Qatar, for instance, has introduced online remittance transfers and is encouraging employers, including employers of domestic workers, to help them to transfer their remittances online. Second, social protection. So accessible information. And several governments in Asia, in the Arab region, have websites with information posted on them. Migrant workers groups have provided this through mobile applications, website, Facebook posts. Food. The government of Saudi Arabia has galvanized food banks into action. Migrant workers groups have provided food packages. Returns, air travel, countries of origin, countries of destination, private sector, charities have facilitated return. It is not very clear how this has panned out for undocumented workers without any resources, unable to pay airfares, and whether there's been health facilities prior to departure provided, because country contexts vary so differently. Health. Thailand, for instance, has universal health coverage, including for migrant workers, for children of migrant workers, domestic workers, their dependents, with some quite innovative features like mobile units, drop-in centers, or migrant workers actually disseminating this information in culturally appropriate ways. Access to violence services. In some countries, government shelters as well as NGO shelters have been open through the crisis. Some countries have deemed it an essential service. There have been hotlines provided for complaints, online web counseling, often very difficult to reach, and these shelters have been very stressed in terms of capacity. Immigration status. So we really need to refrain from arresting, from detaining, from deporting workers. But there are also countries that have introduced amnesty, regularization procedures, for instance, Bahrain and Kuwait in this region. Portugal, that has introduced regularization for migrant workers with open residency, and they can access essential services for a certain period during the lockdown, or Italy, for instance. UN Women in the Arab region has actually galvanized about 45 civil society groups across the region, including women migrant workers groups, women with disabilities, groups from working in conflict-afflicted sites, to actually identify their priorities and advocate for response. This is very important, bringing these excluded groups together with the mainstream women's groups, because this partnership makes for amplified effect. Finally, I do want to say that in the long term, there is great need to increase legal migration pathways and increase decent work for all migrant workers, including women migrant workers, domestic workers, women migrant workers in other sectors than domestic work and in the care sector, covered by strong labor law and social protection coverage that must be effectively implemented. And there are many countries in many world regions that do have this, but this needs to be further finessed and better implemented. Second, the extension of violence against women legislation and services to all women, including women migrants, irrespective of their immigration status. Thirdly, engendered and liberalized immigration policies and laws. And in the context of this region, the need to actually introduce more substantial reforms to the sponsorship system or the kafala system, and to include domestic workers in these reforms. And lastly, to build on pre-COVID and COVID innovations with respect to alternatives to detention and deportation. These reforms, I believe, will benefit migrant workers, women domestic workers, but also countries of origin, countries of destination, families and communities back home, and will improve labor market efficiency. Thank you.
Thank you very much, Jane. We now turn to Marie Seagrave, Professor Seagrave, and who is also, I believe it's nearly midnight in Australia now. So thanks the more for being with us and sharing your insights about Australia. The floor is to you, please unmute. Yeah.
Just one moment. Thank you very much. Hopefully you can see that. Yes, I'm in Australia, so it's much later, and I'm sure there's hopefully other people also listening into the evening. And I'd just like to start, given that I'm in Australia, by acknowledging that I am on the land of the Boon Wurrung and pay my respects to their elders past and present, and acknowledge that the land I'm on belongs to them, and their continuing relationship to that land, to this land, is very important. I really appreciate being part of this discussion, and have just managed to do that, which is not so useful. I'm not sure why it's doing that. I might have to stop that share. It's not quite working. That's better. I think I've fixed it. And I guess I think, I mean, immediately there's resonance with the things that we are talking about. And I guess I also wanted to flag that I come to this issue, the discussion I'd like to kind of focus on tonight, with a research focus on borders, migration and abuse, from trafficking and slavery offences to family violence and its intersections, in particular with temporary migration. So I want to talk tonight about these intersections and the escalating impact of COVID-19, fueled, I think, by what we're hearing, which is the reticence that we've witnessed in many nations around the world to acknowledge the human value of temporary migrants in particular, and the responsibility of nations where they reside. And I think it's important, as we've heard, to recognise that COVID has escalated and illuminated things that we already knew, and has compounded some of those conditions in really serious and significant ways. So I wanted to touch briefly on some of my work pre-COVID, which really brought into sharp relief in Australia how women who are temporary migrants, in the context of family violence, really highlight in Australia, but more broadly, how we need to think about risk differently, how we need to think about defining family differently in the context of family violence, both in terms of geography and in terms of who is the family, who are perpetrators in that context, and include in-laws and extended family who may be living with you, but may also be in another country, but are absolutely perpetrating violence and coercion, and really think about the ways in which the visa someone holds creates significant leverage for perpetrators to control, coerce and instill fear in women. And as I said, these issues have really been amplified in the current context. So broadly speaking, we know that migrant and refugee women have specific and important needs within the context of family and domestic violence. But temporary migration is really critical, and it's critical across most of my work on trafficking and slavery-like practices, but also in relation to undocumented labourers, because in Australia there is a consistent concern and limitation around people who are non-citizens, that the response to exploitation is very much determined by your visa status, and in fact limited by your visa status. And some of the things that play out in this context are relevant in relation to family and domestic violence, but also trafficking, and also the exploitation of undocumented labourers. And that is really that your migration status determines limitations on what support will provide to you, and that is a significant harm and creates significant problems if we think about our commitment to ending forms of exploitation and abuse. But tonight I'm going to speak, as I said, particularly about temporary visas and the ways in which they manifest to create the kinds of harms that I've listed here. So a study I undertook just a couple of years ago involved 300 cases of women in a single year who were temporary migrants who'd sought welfare and migration support. And that really highlighted the significant and specific disadvantage of this group, because in Australia they have no access to financial support, to Medicare or to housing, because they are temporary migrants. So they might be able to access some limited emergency funds, but their rights are very limited, and their dependency in various complex ways, which I can speak to more if people are interested. They have specific dependency on abusive partners, and in many cases their partner's family as well, which gives them as perpetrators leverage for control. And that might be because they are the sponsor for their visa, but it also can be through an Australian citizen being the father of their child, and the way they can use that kind of leverage to threaten women with not only deportation potentially, but that because the child is Australian, that the father will be able to maintain primary care for that child, and the mother will have to leave the country because she has no rights to remain in the country. So it's really absolutely significant to bring into our conversation around what family violence looks like and how it manifests, the ways in which migration status is used as leverage, and not to focus on that only by looking at perpetrators and blaming perpetrators for using that, but recognise that in fact our border regime produces and sustains that form of violence. It's built into the system to maintain precariousness and to limit the rights of temporary migrants. And that must be a critical part of the kinds of conversations we're having about systemic violence and the ways in which institutions can maintain and sustain forms of gender-based violence. This is really critical, I think. In Australia, we've had quite a reckoning with family violence. We've moved some way away in terms of our previous Prime Minister talking about family violence as a national emergency. I think we've seen a shift away from that commitment to some degree nationally, but we have seen, especially in the state that I am in Victoria, a Royal Commission into family violence, a significant commitment to addressing family violence, but not really this kind of engagement with the fact that we can't actually make inroads into this if we continue to say that if you are a temporary migrant, the kinds of support you are offered, the extent to which we recognise your experience is limited because of your visa status. So it's absolutely critical to talk about migration systems and processes in the context of this. Now I seem to be, thank you. So I wanted to turn to think about the more recent context of the pandemic, because what has happened in Australia, as elsewhere, what we have seen is, for me, absolutely the coalescing of other broader work I do around labour exploitation and our responses to migrant labour that we don't recognise or value. And we've seen globally, but also locally in Australia, that the least valued workers, and we've just heard from Jean about this, the least valued workers, those in low paid service roles whose work we don't tend to value, but who we realise are absolutely essential and we rely on their work. Many of them are migrant workers, have been at the highest risk. But also what we've seen in Australia is that our federal government has placed very little value on their livelihood, and very limited recognition of the contribution of temporary migrant workers. And that's most evident in terms of our national response to the pandemic in terms of financial support, that temporary migrant workers were excluded from the financial support that was rolled out nationally. So we've had a JobKeeper system, a way of different systems have been in place internationally to try to support people who couldn't go to work, and to allow employers to keep people on employing them. We have about 1.2 million temporary migrant workers in Australia, and they were excluded from this. So this is people who have student visas, but also those who hold various other visas, totally excluded from that system. So have lost their job, have no income, and they have no right to income support. So this is clearly very significant in the context of family and domestic violence. So the consequence of that is clearly significant for the lives of temporary migrant women. What we've seen is the reporting of escalation of the context and the severity of violence and an increase in the experience of abuse. And this is played out in different kinds of ways, because for women who've lost their jobs, who have no income, there's no financial support to enable them to have any safety net if they wanted to leave, if they wanted to be financially independent of their perpetrator. That option is totally removed. And on top of this, there's also the impact on perpetrators as well. So the financial stress of losing jobs, increased alcohol consumption in Australia, combined with lockdown and the 24/7 presence of perpetrators, all these myriad factors have really seen escalating reports in violence, as I said, and the severity of family violence for temporary migrants. In Australia, at first in the lockdown, there was silence actually really for support providers and for police in terms of reporting. But then what we have slowly seen is actually a huge rise in the number of temporary migrants seeking support from service providers. We have no police data on this because police don't collect that specific kind of demographic data. But what we've seen really in terms of reporting to police is that has been consistent. People haven't been coming to police, but they absolutely have been coming to service providers, which requires some much closer analysis. In Australia, I think this issue really came to the fore when a young woman, Camille Jet Sidhu, who held a student visa, was stabbed to death in her home where she lived with her husband, who was the subject of an aggravated violence order in relation to his violence towards her, and he has been charged with her death. We don't know much about that particular situation in terms of the context, but we know that, of course, this context has given rise to women being in circumstances where they need to stay with their abusive partner because they've got nowhere else to go. And we've seen other forms of violence in the ways that COVID has been used to control access to children, and to control women in various other ways beyond just the ways that might just impact temporary migrants. So we don't, as I said, have a lot of good data. What we have is emerging data. We've had service providers talk about a 20% increase in the service need for temporary migrants in Victoria. In New South Wales, 60% of clients who hold temporary visas had significantly greater need, and all of that need has been around destitution and potential homelessness. So the compounding impact of the failure to support temporary migrants has absolutely contributed to violence and the consequences of that for temporary migrant women in Australia. My colleagues, as part of the Monash Gender and Family Violence Prevention Centre, have just completed 2 studies in 2 states of Australia, looking at support workers across those states. And in both of those studies, it is temporary migrants who are coming to support services who are in dire need because there is no support for them and the circumstances are so significant and unsafe. So these issues have really played out in significant ways, and we're just about to start a rapid case analysis of 100 cases in Victoria to really draw out some of these details. So I guess I just wanted to map those issues in terms of the conversation and some of the things that are happening in Australia that aren't limited to Australia, I think, but one of the really critical things that we see playing out here. And for me, I think in terms of the conversation we're having, I think it's really important at the moment in Australia for us to think about the reckoning with migration systems and processes in the context of domestic and family violence. We see quite often that the investment is in the reactive support services, and we need those investments. but the failure to recognise the ways that the migration system and visa processing and the limitations on women who are temporary visa holders, the way that that compounds their insecurity is something we fail to take into account, and that has been compounded in the context of the pandemic. So I'll finish there, but thank you very much.
Thank you very much, Marie. Thank you very much, Professor Seagrave, also for these insights about Australia. We change continent again, and we go now to Paula Totosa, who is a psychologist working on the field, on the ground in an NGO supporting women. Welcome, and please take the floor, Paula.
Thank you. Thank you very much for the invitation, and thank you very much for the other speakers. I'm going to share just a presentation. Good. Well, I'm from Argentina, from the city of Buenos Aires. The aim of this presentation is to share some of the work we're doing in La Matanza, which is a district in the province of Buenos Aires. And first of all, I wanted to share the situation going on in Argentina. Today is the day 105 of the lockdown. And actually today in the city of Buenos Aires and the province of Buenos Aires, we're going back to phase 1, which is much more stricter than maybe other provinces. So, well, this has many consequences. First, the situation of gender violence in Argentina is very concerning. Women, trans, non-binary people, lesbian, and homosexuals suffer different forms of discrimination and violence in different forms, such as physical abuse in domestic settings, violation of reproductive and non-reproductive rights. Here, there's an image of the fight for the abortion with the green scarves as a symbol. Abortion is still restricted in Argentina, and women are still dying because of the terrible conditions in which they are forced to carry out these situations. There's a large number of missing women that is sought mainly for sexually exploitation purposes. And there in red, you can see an image of an artist's performance. There's work exploitation, mainly of migrant people who are forced to work and live in precarious and illegal conditions, mainly in textile shops, but also in other situations. Unemployment and non-access to formal employment is also an issue, feminization of poverty. And also most women are the main person in charge of supporting and providing care of children and other people. Homelessness and crimes such as femicides, transvesticides, and transfemicides, which in 2019 we had 327. That is one person killed because of their gender every 26 hours, almost one a day. And well, you can see pictures of different performances and different demonstrations against it, and of Diana Zacayán. She was a trans activist from La Matanza, the place where we work, and she was murdered in 2015. The context of COVID-19 has increased all these problems. Many families have no income, but for a small subsidy from the government, which is equivalent to less than $100 or so. The situation of migrants is diverse, and important amounts used to have informal jobs as a street vendors, and as you can see in the pictures, and that is no longer allowed. So there's a lot of families that have no income. Also, informal and irregular work situations increase. Many are migrants, mainly from different Latin American countries, that work doing delivery or messaging services, sometimes spend countless hours in unhealthy conditions for very little income, and they are daily exposed to suffer harassment by the police. Also, we included here a picture of Ramona. She was an activist of Villa 31, a marginalized area of the city of Buenos Aires. She went public because she reported that her neighborhood had been without water for 12 days in the context of the pandemic. She died in COVID-19 in May. And well, there's also there a picture of one of the areas of the neighborhood where she lived. There has been an increase of different types of gender violence. The domestic violence reports rose up since the beginning of the lockdown. And so far in 2020, we had 143 femicides and 80 happened since the lockdown. This context has made everything harder for everyone, not only the COVID-19 related situation, but social inequality, which already existed, as it was pointed out by many of the speakers, has increased dramatically. That is the case of the district of La Matanza, where we work, which is a very large area with a very big population of almost 2 million people. And it's characterized by many contrasts, just as you can see in the pictures, urban and rural areas, marginalized areas, and there's also a territory of vulnerability of rights. Well, this is also, you can see here a map of La Matanza. We work at the two ends in two centers that are called Muchis and Nazareno. Muchis is in La Tablada, right on the top, very close to the limit with the border with the city of Buenos Aires. It's an urban area. And then we work here in the last one in Virrey del Pino, which is a rural area. And as we say also, it's in the distant kilometers, since it's very far from the most urban areas. There we work on the field, we're an NGO, then we work on the field of gender violence, and we have different lines of work, assisting people who suffer gender violence, in particularly women, mainly referred by the judicial system after they have reported to the police. Trans people, lesbian, non-binaries, and people with other gender identities, children who had been sexually abused, survivors of violence. And we mainly have a psychosocial approach to the problematic, since it's a very complex, they are all very complex situations. There's also a program that works with men who have exercised or perpetrate violence. And we try to strongly work in assisting, showing support to these women individually and with support groups, making networks in the community and with other organizations. And in that way, all the map you can see there and all the places are all the centers, all the organizations that work in the territory of La Matanza. This network is called Construyendo Ciudadanía, which means building citizenship. And the map shows up where people can go to get support, to get help, and to find a safe place where we can help them, creating accessibility to rights. The current situation of COVID has made everything more complex. Cases have rose up and we had to reinforce remote and live assistance, access to internet, access to telephone. It's a problem in these most vulnerable areas. And we had also to think, and we're trying to think, how to build other networks in the field and find ways, as we say, to accompany access to justice and to rights, to exercise of rights. We also, we believe the work we do, it's a part of a bigger agenda that has had a very long history in our territories. Nevertheless, we should point out that in the last 5 years, the feminist movement has been massively spread in Argentina. The topic of gender-based violence is still a big issue, but at least it's not a taboo. Media is talking about it, families talking about it, the government is talking about it. More women, children, trans people, and other individuals are coming out to say stop to this violence. and society is listening. Now it's time for everyone in society to do something about it and keep this wave going. Thank you very much.
Thank you, Paula. Yeah, and now we head to the last presentations, and I also want to remind you again that you can post your questions on the YouTube channel so I can collect them and bring them to our speakers. But now our last speaker, Professor Jane Friedman. Jane, please take the floor. And also now we are back in Europe, in Paris.
Yeah. Hi, thank you very much. Thank you for the invitation, and thank you to the previous speakers. Been really interesting, and I think a lot of what I have to say, hopefully not repetitive, but it will build on the same themes that have been raised by previous speakers. So what I want to talk about is briefly some of the results, some of the conclusions of some ongoing research that I've been doing with colleagues in Europe, particularly in Greece and in France, here in France, and also a project I'm working on with colleagues in South Africa with refugees in urban areas in South Africa. And I think there are similarities and differences, but some themes that are shared. And what I want to do is really just talk, if I can share my, hope I can share my presentation. So firstly, just to talk about some issues related to GBV in the context of migration, and then to see how these have been impacted by the COVID-19 pandemic. And as Leila said right at the beginning, COVID hasn't caused GBV, but I think we can see all the ways, even in it's a very short time to have, conclusive results, but even in this short time, we can see the ways in which the drivers of GBV and the factors which cause GBV in migration have been exacerbated in the current crisis, and also the ways in which survivors have been unable to access services. I should also point out just briefly that the research is on women. I acknowledge fully that women aren't the only ones that experience GBV, but that has been the focus of these research projects. So just very briefly to talk about the GBV in the context of migration, and I think as we've seen, as we all know, it's important to see that violence occurs at all stages of migrants' journeys. It can be a factor that pushes women to migrate, specific gender forms of violence. On the journey, when we did interviews with NGOs working, for example, in Greece, in the hotspots or in the Greek islands with refugees who were arriving, the proportion of women that they talked to who had been victims of violence was huge. And then also in countries of arrival, once a migrant arrives in their destination country, GBV continues. And this gender-based violence, I think it's important to acknowledge, sometimes women are seen as vulnerable, but that have to situate this vulnerability to gender violence as the result of structural and systematic inequalities. Whereas the women we met and that we've interviewed have been placed in vulnerable situations by economic equalities all through the migration journey, the fact that they have less resources, the economic resources, which makes it harder sometimes to pay for somebody to help them cross the borders, and then they might need to exchange sexual relations, for example, to pay for their journey. Also, other wider gender equalities, restrictions on women's movement in some situations, the fear of violence, and then the the migration laws and policies. So we've seen in Europe the securitization of migration, the closure of borders, and this attempt to control migration into the EU has led to increasingly insecure and dangerous conditions for migrants who increasingly, they have to pay more and more to help to get the passage to arrive in Europe. they're victims of violence at the borders, they're subject to deportations and refoulement of asylum seekers illegally. And I think obviously the COVID situation, which has led to increasing closures of borders and the legitimization really of border control policy, well, in theory to control the spread of infection, but that has just legitimated even further this securitized border policy that we have within Europe. And then also what's come up is the change in our research is the change in gender relations in the context of migration. The fact that in terms of intimate partners, families, migration can change, can have the impact that women might have more independence, but also can lead to increasing violence within families. And then because of the legal and political context of migration, those women who are victims of gender violence within a family situation would find it hard to go out and to seek support, or they might not want to if they're in an undocumented situation because they're worried about going to the police, going to authorities when you're undocumented. So the various, and I think also within this, I mean, I'm trying to summarize quickly so I don't take too much time, but within all of this, we have to see all the different perpetrators of violence, which can be police and security forces or border guards. We talked to many women who'd been arrested, imprisoned, suffered sexual violence and harassment at the borders on their journey, been put in prison. And clearly that kind of violence men experience too, but there has been a specific gendered forms of violence exercised against women. Also violence by smugglers and traffickers, including sexual violence and rape, or the transactional sex and demanding sex in return for a passage, or saying, we're going to leave you here if you don't have sex with us. So that clearly is a problem. And as I said, where women don't necessarily always have resources to pay, there are huge incidents of transactional sex to be able to move on. There's violence by other migrants who they travel with, by their partners, by local populations. And a lot of the women that we met, if they were single and they felt vulnerable, they would try and travel with a man or with a group. And sometimes it's perceived, I think, by people working, for example, in refugee reception, that these women who are traveling with a family are less vulnerable, because there's this idea that the family is a protector, and these gendered ideas that men should protect the women who they're traveling with, without looking more closely at what's going on, the dynamics inside these family groups or these larger groups who travel together, to see the dynamics of violence that can exist. And again, it's very hard for these women to, especially when people assume, okay, well, you're traveling with a partner, so he's protecting you. So it's harder then to report violence. And this vulnerability is, of course, exacerbated by the poor reception conditions in many countries. And I think everyone's seen the pictures of the hotspots in the Greek island, for example, or the camps around Calais, or in Paris we have migrant camps where people are living, in the latest figures from Lesbos, for example, where there are, the camp that was designed for about 3,000 refugees, and now there are about 10,000, where people don't have access. There are no safe toilet or bathroom facilities for women, where NGOs have reported that they're giving out nappies to women who don't want to go out of their tents at night because they're scared of being attacked if they go to the toilets at night. So these poor reception conditions, the lack of access to hygiene, water, cooking for women who have families, not adequate conditions for their children who can't go to school, they don't have. So all of this exacerbates the vulnerability to violence, and is a form of violence in itself, which is perpetrated against these women. And there are far too few services for the survivors of violence. Very few, for example, for the refugees and migrants who, even though NGOs and associations that people know, and they say, well, these women who are arriving, especially who've transited, for example, via Libya, or and have had very difficult journeys and been victims of and are survivors of sexual and gender-based violence, but the lack of psychological services, lack of medical services, the lack of sexual and reproductive health services, lack of access to contraception, all of these things are huge problems for these women. So how has COVID perhaps changed this or made it worse? So thinking about, and from the initial research on the impacts of COVID, and I think this is echoing again what's been said by other speakers, but the lockdown, the confinement has had huge impact. So women can be trapped in unsafe accommodation with violent partners, or in unsafe occasion where they can't get out. So all the many refugee camps in Europe, many accommodation centres, because of fears of COVID, have just been closed. So it's the barriers were closed, migrants were locked in, and so that reinforces the difficulties in getting out, in seeking help for these women. In Paris, where I am at the moment, the reception centres were closed. Normally NGOs go in and out, people go in and out, the refugees can come in and out, but this closure reinforces the fact that women are stuck in these places. Also in France, some of the government said, okay, with the informal camps, we're going to move these people because of the threat of COVID, and in the informal camps, there was a move to try and move people into accommodation centres, but again, without these being whether suitable, no safe spaces for women, and again, people being closed in, often far from previous support facilities. There's also the problem of the shutdown of informal economy and the loss of livelihoods for migrants and refugees who are working in these areas. In our project in South Africa, many of the women, all of the women, in fact, that we talked to and interviewed were working in the informal economy as market sellers, selling things on the streets, doing sewing or hairdressing, and that was all completely cut off. So they lost their livelihoods, and because they were not citizens, and many were undocumented or in the process of claiming asylum, but they weren't citizens, they didn't have access to the government's food packages that they were providing to compensate for the lockdown. So this loss of livelihood is also a really important problem. And again, I think, as a previous speaker has said, can push women into transactional sex, other means of trying to make money to survive. And clearly the fact that the shutdowns led to the fact that civil society organisations, who in many cases can be a source of support for refugees and migrants, had to stop or very limit their activity and could no longer work with the migrants. In the north of France, around the Calais area, for example, the support to the camps there has been severely limited. And so that also has a huge impact in terms of livelihoods, in terms of services, also in terms of, people who are providing health services and providing services for prevention of violence and for survivors of violence. And then a second aspect of this has been the suspension of official services in many countries. So asylum claims are suspended. In the Ile-de-France, the area around Paris, the asylum reception offices was just, okay, at the beginning of COVID, the government just closed the system and it was suspended. So anyone who arrived could have no, and if you don't have an official claim, you don't have any access to any support for accommodation, for example. So all of these official services which were closed down, again, push people into vulnerable situations. the hospital services which were concentrated on COVID. So all the kind of accessory, which aren't really accessory, but anything, all the other services provided by hospitals, for example, psychological support, sexual and health services, service for, victims or survivors of violence could also be closed, and shelters for protection, which are closed. So the closing down, the kind of combination of confinement and the closing down of these services pushes people into even more and makes worse. I mean, I don't think they create the vulnerabilities to violence, but making these vulnerabilities worse, and making it more and more difficult to seek help. So I just had some pictures. This is a picture of one of the informal camps around Paris, which, and at the same time as there's the lack of confinement, lack of access to services, and although the French government said, yes, we're going to rehouse all these people because of the lack of COVID, clearly they're still there, and the police is still trying to break up these informal camps with people have nowhere to go. And all the, many of the associations who were intervening, who were trying to bring help, have suspended their operations. The same, this is a picture in Dunkirk in the north of France, where there is a centre where there are many women, children, who, again, these are the kind of conditions they're living in. So I don't know if I've spoken for too long, but I think I'll stop there, and hopefully if there are any questions, I'm welcome to, happy to answer them. So thank you again for this invitation for the seminar.
Thanks so much, Jane. Thanks, Professor Friedman also. We also have got quite some questions, so thanks so much also for the audience and for all of you who are still with us. Since time is running, I would suggest I summarize them a bit, and maybe you can take notes, each of you, and then at the end respond to them in summary. So let me see 1 second. So one question is by Susanne Rodman, and I want to start with this question because I think it's a very relevant one for all of us. So she says, how do you deal with the issue of researching the vulnerability of migrant women without stigmatizing their culture or treating them as passive or weak victims? So I think that's a very nice question for all of us to reflect on. Then I have very specific questions. For instance, by Rami Sharaf, who asked to Jane Vicuña, but also to Jenny, about Egypt, where there is an initiative where domestic workers are linked to families through third-party protection agencies. How can we take this initiative and institutionalize it? Then also from Ernest Adu, what is your view of letting the migrant workers have access to information and support services for them in the destination country? So I suppose Ernest means maybe before. Then also we have a question by Loy Rego. What changes and further actions are needed, and how do we improve and strengthen sponsorship systems in the Arab and Asian regions? So I think also particularly for Jane also to think about Arab and Asian regions, and what are challenges to reforms in Asian and Arab regions at protecting the rights of migrants. Also, then one very relevant question also, what are alternatives to detention and deportation? Also very important questions. Maybe let's start. I hope I didn't wait. Then a question by Trinidad Aristia. I hope I pronounce all your names wrong. Apologies if not. So she asks, have you heard how NGOs working on SGB projects have either adapted their programming or stopped it? If adapted, what have been the mechanisms? Can you give any examples, maybe especially to Paula also? So about, and also about informal camps to Jane Friedman, about where is the UNHCR doing anything about them? Also Jenny Phillimore might have insights on them, about informal refugee camps. And also about practices, best practices in countries with conflict situations, so where conflict is going on right now. I hope I picked up on all the questions. I will have again a look, but I would give the floor to you, back to all of you, with some final reflections, and if still some questions will come in, I still can pick them up. Yeah, so maybe we start in the order of speakers like we had it. Yeah.
Hi, lots of questions there. I'm not going to respond to them all. Time and I don't have answers to all of them anyway. In terms of how to research vulnerability without stigmatizing women and well, men in these situations as well. Certainly within the Sarita project, we've tried to focus not just on the moments of vulnerability, but also on the moments of resilience. And we've used a social constructivist approach. So we're very much looking at the stories of survivors and asking them to tell us, what are the things that matter to them and where things have worked and how they, and also getting them to envisage their futures. In the past, when working with refugees, we've actually, for the last 15 years at the Institute for Research into Superdiversity, been running a community research training program where we trained over 100 people from refugee communities in research skills and worked very closely with them. Many of them have gone on to research posts across the world and been doing PhDs and all sorts. So that's been one route forward. So it's about focus, but it's also about working with people who are the real experts here. I've got a bit of a bee in my bonnet, if you like, about access to information, because one of the things that's come through the Sarita project in relation to perpetrators, which receive very little attention in work in this area, is that when they have information that what they're doing is illegal and they may be locked up or they may be deported, what we've seen is once they've become aware of that information, or women or other perpetrators have heard that they can actually use the law to try to prevent violence against them, that you do see a change in behaviour, certainly on physical violence. So I think one of the easy things that we've suggested in the Sarita project is that when obviously legal migrants enter a country, but as much as possible sharing this with irregular migrants as well, sharing information about the rights and the wrongs and what's legal and what's not legal and what you can do if there's a problem really, really makes a difference. And it actually does give women a little bit more power in situations where they're quite powerless. What can NGOs do? How are they adapting? It's tricky with low levels of resources, and one of the big asks here is for states to invest further in NGOs at this time. What we've observed in the UK is lots of use of food collections and dropping food off at vulnerable migrant homes, particularly those who are shielding. And in Tunisia, one of the NGOs advocated for regularization for irregular migrants for 3 months. That happened, and then those migrants were able to access social welfare. So that seems like a really important way forward. I'll give other people time now because I know we haven't got long.
Okay, so I'll briefly respond to 3 questions that were put to me. One of them was, what changes are needed in the sponsorship or the kafala system in the Arab region? I want to say that many of the Gulf countries and the Arab states of Jordan and Lebanon have brought about some changes and reforms already in the kafala system, and this is welcome and appreciated, but more needs to be done. So what would we like to see ideally? Number one, I think sponsorship needs to move from a particular private employer to the government. Number two, a worker's entry must be on the basis of an employment-based visa and not on the sponsorship of a particular employer. Number 3, workers must have the right to renew their visas and their work permits themselves and not place this on, provide this or task the employer to do this, because oftentimes there are lapses and the worker turns undocumented. Fourthly, a worker must have labor market flexibility. They must be able to give the employer a sufficient notice and contract a job with another employer. There must be a bridging visa that could be provided where they are given time to contract another job or time to recover wages that are not paid or bring, have access to justice. And finally, in those cases where they still have to take the permission of an employer to exit a country, those exit clauses or provisions must be repealed. And this would help countries of destination, it would help countries of origin, it would enhance the labor market and labor market efficiency, it would help the worker. The second question is, what are the alternatives to detention and to deportation? And I'd like to answer this in terms of the short and medium term and the longer term. So it's very important that we have regularization measures in place. Now, countries have introduced amnesty, and they are allowing workers who want to go back without penalty and allow them to come back again. That's the deal. But those who continue to remain undocumented and have not identified themselves will have legal penalties to pay and deportation and bans on return, perhaps. So I think we need to move towards regularization and, ideally speaking, rights on equal par with citizens as well. Portugal has introduced regularization measures, and if these can be made features, long-term features, this would be very beneficial. In terms of detention, there are countries that have banned detention or say no to detention, and instead of detention, they have safe homes or facilities run by NGOs with gender-sensitive standards, such as protocols governing physical and social infrastructure that would promote women's safety and security, training for the staff in those shelters to treat women according to human rights standards as well. In certain countries, if you're awaiting deportation, then the so-called detention is much more human. I'm not talking about detention, but I'm talking about I'm not talking about need for detention, but I'm saying that in certain countries where there is detention, it's done much more humanly, wherein you stay in a residential area, you report to the authorities, if you change your residence, you report to the authorities. It's not in a securitized, heavily securitized, a penal kind of setup. But I will say, from the longer term, there is need for more legal migration paths, better social protection and labor coverage. And in many countries in the Arab region, they are introducing or looking at labor market demand, supply, better labor market governance, looking at skills upgradation, certification, portability of skills, also looking at national competency standards for migrant workers, including domestic workers. So these are things that are necessary that will go a long way to diminish irregular migrants. And the last question was, what are the challenges, though we have reforms, what are the challenges that we face? So yes, there are reforms, but for instance, in this region, we've got labor law reforms, but if you still have the sponsorship system in operation, then a domestic worker who's fleeing an abusive situation can turn undocumented and has no rights after that. So there needs to be a certain harmonization between the laws. And, so that's number one. Number two is the design in implementation. So if you do, and there are countries of origin destination that have pre-departure training programs, briefing workers on the costs, the benefits, the violence that can accrue to them, etc. But these need to be focused on workers' rights. They need to know where to access what help. They need to be women friendly, had in places that women can access at times that are suitable for women, suited to the sector that women work in. The quality of these trainings also has to be improved. Thirdly, a lack of accountability. So in law, employers are banned in many countries from confiscating travel documents. But unless these measures are enforced, unless there are monitoring mechanisms, redress complaints mechanisms, and conditions which allow women access to justice, then the law falls flat. So the lack of accountability. And lastly, there needs to be social norm change. So unless we change our attitudes towards low-skilled workers, and unless employers see the value, value in respecting the dignity and an interest-based, reason to protect workers, this will not change. Thank you.
I'll just, did you want me to Yes, great. I'll just respond really quickly to the first question around vulnerability. And I think one of the things that's most important to me, perhaps to highlight here, and the way that we think about this is not to think about vulnerability as inherent in a person. Gendered violence occurs all across the world. And so culture isn't something outside of where we are, where we're looking at other women and thinking, well, your culture or I think the work that I do is about not ascribing vulnerability to women in the sense that it's their vulnerability. It's about the way that systems operate to produce precariousness and to create those conditions. So most of my work is really about calling to account the failures of criminal justice and immigration processes and ways, in fact, that they can be intended to protect and, in fact, sustain conditions of exploitation and abuse. So I think that's one of the most important things to me. And the work that I do is about that. We had an inquiry last year in Australia in relation to dowry abuse. And the conversation there was, well, this is women bringing this into Australia. And I said, financial abuse occurs in the context of family violence. It's a form of financial abuse. And we have to recognise it's not dowry, it's the problem. It's the ways in which we can use money to leverage and coerce. So that's really critical. It does play out differently, but we can't start othering those things. I think that's most critical. And I guess my only other brief comment, given the time, is to think about what Jean was saying in particular, but also in relation to information provision and regularisation. Most of my work is about the intersections and the failing of criminal law. And there's often this idea that what we can do is we can make law and then we're going to find victims, or that will rescue people, this kind of sense of benevolent rescue. We never talk about how women are motivated and need to work. Why come forward when the only response is a criminal justice response? Prosecution results in nothing. It doesn't allow you to feed your children. It doesn't allow you to have an income. So if we don't recognise the kinds of pressures and the motivations of workers, we're never going to address exploitation, because there's no reason to come forward. Why would you come forward? I did a huge project last year across ASEAN with UN Women and ILO. Migrant workers want to find more work. If the work's not good, they'll try and negotiate it to make it good, or leave and find more work. So we really need to be thinking about that. And we also, one of the things that's critical in Australia is we often think about when people arrive, we should give them information. No one takes that information. It's absolutely essential that we continue to, through every mechanism. I mean, in Australia, the simple message should be, he can't deport you. Women are told by partners that he can have her deported. He can't actually do that. But that's not well understood. Visa systems are complex. They're very hard to understand. And so I think those things are really critical for us to attend to.
Okay, I think I'm next. I'm gonna try to briefly reply to one of the questions regarding NGOs. They're still working or have adapted their programs or stop it. In our case in Argentina and where we work, we cannot afford to stop working. There's a woman being killed or a person being killed because of their gender every day. And we cannot afford to stop, so we adapted, and we adapted creating or reinforcing the network support in the territories with neighbors, with the schools that are giving food, with some food banks or community centers that are still in contact, direct contact every day with the population, calling people every day with our own resources, right? With my personal phone and all the workers. And yeah, we cannot afford to stop in this context. And also we try to create networks with the community. We believe that's what can help in this situation, and also to articulate and to insist, at least in Argentina, that the government can declare the gender emergency in the country. That's a thing that it's in the feminist agenda, and it's very important to us. So that's it.
Hi, I think we don't have much time left, so I'll try and respond very quickly. I just wanted to reinforce what others have said about vulnerability, and clearly what I was trying to say about vulnerability, I hope it came across this way, but that it's nothing that's essential or inherent in a person, in a woman, but it's really the creation of, it's creation of political, economic circumstances. And for me, and I think what's happening in Europe, vulnerability to violence has been created by EU and by national migration policy and migration laws, which have put people in these situations. And I think one of the problems in terms of culture is the way that in dominant discourses, in political discourses in Europe, often there's this othering of migrant and refugee women. So here in France, we had a big debate on gender-based violence. And when they talked about migration, they wanted to talk about female genital mutilation and forced marriage. And I think that's quite a common theme. And I think one of the things we really need to do. And when we talked to refugee women in our research, that was one of the things that they felt as a symbolic violence, that they were stigmatized, especially Muslim women who were wearing a hijab, for example, who would tell us, people think we're stupid and dominated because we're Muslim women. And I think the way to get over this is to really, as has been, the other speakers have said too, as to let these women speak, not try and speak for them. They know the most about their situation and what they need, and they can be victims of violence, but they know best what they need in terms of protection, if they need protection. So I think that's very important to bring this out, and not just to make assumptions about this. So that was one of the points. And I think there was a quick question about the UNHCR in France. The UNHCR, because France has its own national asylum refugee policies. UNHCR is really has a very small and doesn't get involved, apart from a small advisory role. They have a very small office here, so no, the UNHCR is not involved here. So I think I won't say too much because I think we're running out of time. Thank you very much again.
So thanks so much. We are indeed out of time, but thanks so much to everyone who listened, and also to our great speakers. Quite some asked if it's available, the presentations are available. So yes, they will be online on YouTube. So you have the chance to re-listen to them, or also recommend them to others. So thanks again so much. And one thing I also wanted to say, maybe to summarize and also to borrow from Marie's report, it's really a shadow pandemic. And I think this has come very clear that we should think not only about COVID and such, but also all the other crises this has brought out as a shadow pandemic. And I think that's a very nice framing of the issue and also of the urgency of the issue. So thanks again to all of you, and also want to remind you this was our last webinar by the Migration Policy Center for this academic year. So we all wish you a wonderful summer, hopefully, but always thinking and being curious also about migration issues. And we have the newsletter, of course, where you can sign up, and our social media activities where you can keep up with our work and also the work of our colleagues. Thanks again to everyone, and in particular to everyone across the globe with different time zones who we come together and bring in these different perspectives. Thanks so much, and goodbye.